Hello and welcome to the Functional Solution Podcast, brought to you by the American Academy of Functional Health. My name is Dr. Tal, and joining me is our wonderful co-host, Dr. Esha.
Hey everyone. Hey Doc.
Good to see you, Dr. Esha.
Same. Good to see you always.
So, in our class today, as within every class, we're going to explore some of the root causes behind certain conditions or symptoms that your patients might be experiencing or struggling with. And we always try to have in this class show you some of the interesting data that came out in the recent published articles, and of course show you some of the mechanisms that are unfortunately not taught in medical schools or nursing schools, of what are some of the triggers or drivers or contributors to chronic conditions, and of course evidence-based tools or strategies to help your patients. So if you're looking for root cause, functional and integrative medicine tools to help your patients, then you are in the right place. And I asked Dr. Esha to join us because she's got years of clinical experience using functional and integrative medicine for her patients. So thank you so much for being here, Dr. Esha.
Yeah, thanks for having me. I'm really excited. I feel like this topic is so different, right, from what we talked about in the past. I'm really excited to dive in.
Yes, absolutely. And if you've been listening to our classes, you already know that we typically kind of do a deeper dive into the root causes and mechanisms beyond genetics, old age. We focus mostly on the epigenetic factors, which is essentially what's in our environment, our diet, our also internal environment, like gut ecosystem, that can impact or turn on and off certain genes that can contribute to disease, right? But today we're steering a little bit away from more common medical conditions, and we're going to talk a lot about a very complex and often misunderstood topic, which is addictions. And this is something that it's a topic that I feel like, at least when I was going through different trainings, I didn't get enough learning about, and so this is going to be really, really helpful to do a little bit deeper dive into addictions. And of course, there are so many different types of addictions, but we're going to focus on addictions in general, and we'll also give you some more specific examples of interesting studies that came out and protocols that you can use for your patients. And we know that addiction is not just a behavior; it's deeply tied to neurochemistry and stress physiology and trauma and also metabolic health in some cases. So beyond the psychological aspect, we're going to go into what's going on in our brain when a patient struggles with addiction. That could be alcohol addiction, video game addictions. That could be pornography addiction. That could be all sorts of drugs, right? We're going to talk about what's happening in our brain. So I feel like, Dr. Esha, this is going to be a fascinating class.
Very fascinating, especially because, like you mentioned, there's so many different types of addictions now, and we're finding that the same brain chemistry tends to happen, right? So you think about social media addictions and even the ease of shopping via social media and all that now. So I think this topic applies to pretty much, everyone in some capacity.
Yes, absolutely.
Yeah.
And we know that there's a few reasons, obviously, why we picked this. One, we feel like there's not a lot of training in this field when it comes to actually helping those patients. And second, it's very, very common. Just to bring some interesting statistics from the 2023 National Survey on Drug Use and Health, they reported that close to 49 million Americans aged 12 and older, right, met the criteria for substance use disorder in the past year. We're talking about close to 1 in 6 Americans age of 12 or older that are struggling with these conditions. And of course, about 1 out of 7 receive only about 1 out of 7 receive any type of treatment, and only 1 out of 4 actually access the treatment. So we know there's a lot of struggle. We know that, as you mentioned, social media, for example, has become more and more addicting, right? They know
Mm-hmm.
kind of trigger push those little buttons
Yeah.
and get us to spend hours on. Same thing with TV, the news, right? The fear factor,
Yeah.
all of us captive, right? So interestingly, we're going to talk about some of the pathways, mechanisms, but um, a lot of it really is in our understanding the physiology in our brain and what's going wrong, what's the imbalance
Mm-hmm.
or dysfunction, right?
Yeah.
Because we have a prefrontal cortex, which allows us to make logical decisions, but when emotion kicks in, we know that our amygdala can kind of take over, right? So we're going to talk a lot about some of those. So it should be really, really interesting class for all of us, because those addictions are all those temptations are just all
Yeah.
around us, our
Yeah.
family members, our friends, our community. It's just those temptations are all around us.
Yeah, and it's
So
the same brain chemistry. We all have the same neurotransmitters, so it's not special neurotransmitters for different conditions, right?
exactly. So let's go into the first one, Dr. Isha.
Yeah, yeah. So the first one we want to chat about are neurotransmitters, which is a huge kind of area of study for addiction and kind of just neurological health in general. So neurotransmitter imbalance is what we're going to talk about. Beyond the stats that Dr. Tal just mentioned, addiction really is a fundamental shift in how the brain's neurotransmitter systems, namely dopamine system, works, especially within this reward pathway called the mesolimbic reward pathway. And then the circuit, which is the circuit connecting the ventral tegmental area to the nucleus accumbens. So those are kind of more anatomy terms, but essentially we're thinking of this brain dopamine system within the mesolimbic reward pathway. And so as you can see in this picture, let's simplify it a bit. These are different neurotransmitters involved in addiction. So you'll see the different neurotransmitter, dopamine, reward, motivation, GABA, which is that more neuroinhibitory, kind of tells you to, hey, turn it off, turn the volume down. In addiction, however, the GABA response is often suppressed. So you don't really have that natural built-in inhibition break as strong as you usually would. So you see CRF, which is more so related to cortisol stimulation down the line. You see norepinephrine, which is kind of like rev you up, associated with stress, more withdrawal. Our endorphins, our natural internal opioid, serotonin, which we all know about, which more so associated with mood and impulses. And then you see your glutamate, more so cravings and learning. So let's take, for example, dopamine at the very top right. In the beginning, when someone uses an addictive substance or engages in a rewarding behavior, the brain is going to release quick bursts of dopamine. These like phasic dopamine surges, so kind of goes up when you have this high and then kind of goes low. So these surges create these strong feelings of reward and reinforcements, which is encouraging us to repeat the behavior. But with like repeated exposure, the system actually starts to adapt. So baseline or tonic, the dopamine levels gradually decline, meaning that everyday experiences no longer actually feel as rewarding as they once did. And at the same time, our brain actually becomes highly sensitized to cues linked to the addictive behavior. A familiar place, a certain smell, or even a passing thought can now trigger these like outsized dopamine spikes, even without the substance or activity being present. And then this huge shift is going to create motivational imbalance. So natural rewards lose their spark, so not as exciting anymore. And then these addiction related cues are going to take center stage, powerfully driving our attention, craving, behavior. And in a sense, the brain's motivational circuitry is being rewired, prioritizing these addictive stimuli over normal life experiences. And so I find that this is something like I said in the beginning, all of us kind of struggle in our own ways with different little things, but for some people it's really pronounced. You think about substance use disorders, but just in talking about this, I think about the phone, we are using our phone to buy something, and how just that excitement of, buying something over the phone, and you kind of over and over the whole piece of that, it can be really addictive, to be honest with you. And then you think about patients struggling with actual substances that alter brain neurotransmitters, and then it leads to this other pathway, and also damages their system at whole. So I do think that our patients struggling with addiction need a lot more attention and care from a functional medicine perspective, because there's so much we can offer them, and in regards to neurotransmitter evaluation, supporting neurotransmitters, and things of that nature. So let's pop into a quiz. Do our first quiz. So what happens to baseline dopamine levels with repeated exposure to an addictive substance or behavior? A, they steadily increase over time. B, they remain unchanged. C, they gradually decline. Or D, they fluctuate randomly. So the answer is going to be C, they gradually decline. So they're outside of dopamine, right? We saw the picture with all the other neurotransmitters. Dopamine's not the only one that could be off balance. For example, we think about glutamate, more excitatory. This one plays a huge role in how addiction develops and how it persists over time. So when someone uses substances over time, the normal glutamate signaling also gets thrown off, especially in our prefrontal cortex, areas involved in decision making and rewards. So this imbalance with glutamate kind of makes the brain more susceptible to loss of control and addictive behaviors, which is why cravings can feel so intense, and why, relapse can happen even after somebody has stopped using for a while. It has a lot to do with our brain chemistry. There are specialty tests that can directly or indirectly, I would say, indicate levels of neurotransmitters with your patients. They're used quite often in functional medicine. Sometimes they're really useful for patients who have mood disorders, cognitive decline, or struggle with addiction. And so I would say any kind of neurological case that maybe you're struggling with, that may be worthwhile at some point to incorporate evaluating neurotransmitter chemistry, if you will. So if you're interested in learning more about these types of tests, you can always kind of log into your advanced and clinical functional medicine platform. And then, we can also book a coaching call with us. Like if you have a case study and you want some help, and we can kind of help you offer functional medicine right away. Again, this is a part of your program and does not cost you any extra. But yeah, when I was talking about that, Dr. Tal, I was thinking wow, I think about myself and how I just get on my phone and I can buy something and it just gives me this burst of excitement, right? And then after time, I'm I realized oh wow, that's actually an addictive behavior. So I can self-correct it. But you think about substances and then the more potent action of those and how it's so hard to navigate that picture. Oh, I can't hear you.
And one of the things that I also wanted to mention was really interesting, that we know that there's very specific beyond the physiology of our brain, right? Once we have kind of rewired our brain, right, there are very specific triggers. And there's a interesting article written by the addiction centers about statistics, and this is the American Addiction Centers. And this was more specifically, most of the time we're talking about conditions that our patients can struggle with or our community members. But this was really interesting because the article was very specific to addictions among healthcare practitioners.
Interesting.
And they stated here that the surveys are showing that about 10% of physicians and 15% of nurses are struggling with some sort of addiction. That could be alcohol, that could be pharmaceutical drugs, or even sometimes illegal drugs. And it's really interesting because according to that article, the imbalance in the neurotransmitter is probably already there, right? Let's call it the rewiring. But it's interesting that they were mentioning that stress and burnout in healthcare, for example, was one of the leading causes.
Oh, wow.
Right? Is the high stress nature of their employment, their place that they're working in. Lots of patients, it's kind of rushed, right? Trying to keep up with deadlines. Also, sometimes um, sometimes like the access to the prescription drug, or sometimes these are different factors that can you know kind of push them in that
Oh yeah.
direction of constantly
Oh yeah.
going towards the addicting behavior, which is interesting because when I interviewed a few of the community members that came to see us, they're like, why did you learn functional medicine? Then yes, we hear a lot of like, yeah, I want to find out the root cause. I find out really why my patients are sick. I want to be able to answer those questions and also find better ways for them to become healthier, right?
Mm-hmm.
But it's interesting that sometimes, like, you'll hear practitioners that are saying, I'm coming into functional medicine because I do want to kind of step away from that stressful environment that I'm working in a hospital, inpatient department, or urgent care, where I want something more. I want to work one-on-one with patients. I want to have more time. I don't want to be rushed. I don't want to fight insurance companies, right? I just want to focus on the patient. So less stressful environment, and avoiding burnout, right? Having that balance between not working too many hours, not doing 12-hour shift in a hospital. Instead, you can do, some of our community members want to do 6 hours or 8 hours, just see a few patients, get paid well privately, and step away from avoid burnout, right?
Oh yeah.
So
I have a lot of colleagues or friends that I know of that are more MDs, DOs, and they always kind of are talking about the rat race, and they're just like, this is just the nature of the business, and they're young, 40s, and they're already frustrated or burnt out, and they just they don't know what else exists, So exactly. I think this is why it's important that we do what we do, because there are other options.
Exactly. And stress, I know we prepared something to talk about physiologically the impact of stress. Like if a doctor, a nurse, pharmacist, whoever it is, PA, are in that, kind of stressful environment, even if they feel like they have somewhat adapted, it's still impacting our physiology, which you'll talk later about the HPA axis and addiction. But I wanted to reinforce something that you were saying, and this is also a really interesting read for probably every healthcare practitioner. I think every parent also should read it because it's really interesting. But there's a book published by Dr. Anna Lembeck. She's a psychiatrist and also a medical director of addiction medicine at Stanford University School of Medicine. And we're showing right now the picture of the book. And this doctor spent decades treating patients with substance and behavioral addiction. And essentially, she published this book about how dopamine drives compulsive behaviors, right? And it's called Dopamine Nation, Finding Balance in the Age of Indulgence. And we wanted to take some of the principles from that book, because that's we always try to simplify things and make them more practical, right? So this is really interesting, where Dr. Anna Lemke is writing about the process of reward that modifies our behavior, and how our brain starts to compensate faster and faster and more forcefully, kind of tipping the scale over time towards pain and craving. And so this is really interesting because we wanted to show the process of how our brain is getting into the kind of like rewiring in itself, right? So let's show the step of addiction. This is by obviously the source is Dr. Anna Lemke, and again, that's from the book, which we highly recommend to read, Dopamine Nation. And so the first phase is essentially exposures to create a fast dopamine surge in a reward pathway. So first, your internal balance tips towards pleasure. So let's say somebody had one of your patients had a tough day at work. That could be physically, that could also be sometimes like physical, that could be also emotionally, psychologically, right? They're in a high demanding, high stress job. They go home, they have 2 or 3 beers or 2 or 3 cups of wine, right? They feel better. now they have a certain sensation, right? That could be same thing with pornography, same thing with video games, same thing with many of those potentially addicting behaviors. So now they get what we call the hit. They get a dopamine hit. Afterwards, essentially comes the after reaction, right? So that's where the brain autocorrects to re-level the balance, and then it tips to the pain side, what she refers to as opponent process, or essentially what goes up must come down, right? That's the response. So you had this high, and then you're crashing. And one way to think about it, it's kind of like a hangover, right? You're partying with your friends in the evening, the following day you feel hanged over and you're like, what the heck happened, right? I feel awful, right? Now the next, and this is why we got like this low battery, right? The third phase, we got neuroadaptation and tolerance, which essentially with repetition, the pleasure spikes get weak and shorter. So now they want to re-experience the same sensation. So let's say they drink more alcohol, right? And what happens is they get less of a dopamine spike, right? And then the after effect impact of the, let's call it the hangover phase, is stronger or longer, right? So now you need more of the same substance or behavior to get the same impact, the same secretion of that dopamine. Number 4 is the dopamine deficit state. It's a withdrawal, right? And this is where everything shifts more pain, right? Everyday joy feel very flat. It's kind of like a flat effect. So they don't get excited about things that they should be excited, like relationships or even their work that they're doing, right? It's no longer feeling enjoyable for them, right? Or hobbies, for example. Step number 5 is the cue triggered craving, learning and memory. Essentially, the brain remembers pleasure and pain with durable traces. So as Dr. Esha mentioned, people, places, thoughts can reignite the desire. So for example, I used to work with people who are trying to lose weight, and every time driving through a certain restaurant back home from work or certain fast food chain or whatever it is would trigger them to pull over and go into the drive-through, right? For alcohol, individuals that struggle with alcohol or pornography or video games, right, or social media, there's certain things that could trigger that, right? Step number 6 is the compulsion, and that's again with the balance now tilted to pain. Craving is easily provoked and drives continued use or relapse, right? Even though they want to stop, like many of them want to stop, they understand that this is starting to derail them, their life. And the last phase is where we want to help our patients to get to, which is the reset. So the reset is really important because in that phase, Dr. Lampke recommends taking a break from the addictive substance or behavior, typically for about 30 days, which allows the brain dopamine pathway time to rebalance itself. And during that time, the brain starts to restore the natural dopamine balance. And this is often reinforced with what we refer to as self-binding, which is putting intentional limits. So for example, for somebody who has food cravings, they're trying to lose weight, maybe taking a different route than the usual route that triggers them by seeing their favorite restaurant or smelling certain things, right? Other ways is, for example, not having alcohol in the house and not driving to places that have alcohol, that sell alcohols, right? Which could be harder and harder to do these days. And so you want to set clear rules, removing triggers, and also schedule specific activities which don't leave you time to just be there by yourself, sitting down by yourself, right? And so another thing that Dr. Lampke is recommending is hormetic activities, which essentially are mild, controlled stressors. that stimulate the body or brain to adapt to stress. So for example, exercise. Exercise is a hard activity, right? Could be psychologically and physically hard because you got to keep yourself motivated and push yourself. But then you get a good sensation of relief, right? With endorphins. Now, cold plunge, mindfulness activities such as meditations, all of those are hard stressors, but they're controlled. They're very controlled, right? And those mild stressors are really beneficial in stimulating dopamine in a controlled way, which helping our brain again to balance without relying on the addictive substances. So this is a simple model. You can read more about it in the book if you want to. Now, let's go into a little pop quiz. So according to Dr. Anna Lampke treatment approach, what helps to reset dopamine balance? Option number 1 is continuous use of similar dosages or smaller doses of whatever they are addicted to. B, a period of abstinence around 30 days followed by healthy discomfort practices. C, avoiding all forms of stress or discomfort. D, replacing the substance with another dopamine releasing habit. So which one do you think it is according to the book? So the answer is B. So Dr. Lampke recommends a period of abstinence around 30 days followed by healthy discomfort practices. So we said followed, but we typically refer to like integrated right away. Like right away, remove the triggers as much as possible and introduce new behaviors like physical activity, meditation that puts controlled stress on our body and brain. So those are important tips that will help you and your patients to adjust. And this is interesting. I read another article that talked about also for digital detox. And since we're all bombarded with news and social media and all that stuff, they were talking about 1 day a week to do a social detox, which means you don't touch your phone 1 day a week. And if you think about it, in religious practices, we have there's the Shabbat, the concept of the Shabbat, and there's the concept of Sunday, right? To rest, spend time with your family. So these are all really interesting concepts of like ancient concepts that anchored in religion. But think about the importance of it in this digital age, right? So Dr. Esha, I'm sure that
I think that's excellent.
You probably read similar things, right?
Yeah. There's a Jewish community here in St. Louis where I live, and I always am jealous when I see them walking down the streets. I'm like, oh, I'm sure they're, what is it called on the weekend when there's no no interaction?
The Shabbat.
Yeah, and I'm like, I know they're just having the most peaceful weekend. They're away from their phones. Yes. But I do try to do social media detoxes, once a month, and I'll just go a day. And I'm like, wow, it makes a huge difference. I feel like my day is more calm, it's more peaceful. I'm not anxious because I saw something crazy on social media. So I do think those small things you mentioned make a big difference. And I love that you mentioned the hormetic stress, like something, like exercise, right? That can really kind of rewire or retune our system. But yeah. So let's talk a little bit about the HPA axis, or stress, if you will, kind of our stress system on overdrive, and specifically more so alcohol, pornography addiction. So HPA axis, I feel like, is it sounds like a big word, hypothalamic, pituitary, adrenal, but it's just describing the order of the systems, right? And so the HPA axis, it plays a pivotal role in how stress is going to interface with addiction. So this hormone, or this factor, corticotropin releasing factor, basically we call it CRF, abbreviation. This and cortisol are going to modulate reward circuitry and can intensify both cravings and relapse risk. In alcohol use disorder specifically, chronic exposure often leads to a blunted responsiveness of that HPA axis. We're going to show you a picture in a minute, especially during early abstinence. So a maladaptation that can make individuals more vulnerable to even a stress-induced relapse. So let's take a look at this image Alcohol research, current reviews. It's published in 2012. We don't have to pay attention to all the little words here. Just pay attention to like the images in the 3 sections. So the first section is showing us hypothalamus. The second section is showing pituitary. Both of these are actually part of the brain. And then the adrenal glands, which sit on top of the kidneys, right? So the hypothalamus, is going to stimulate CRF, which is corticotropin releasing factor. And this is going to set off a chain reaction. This corticotropin releasing factor is going to go to the pituitary and say, hey, something's happening. We need you to, get some stress signals out. And so one of these factors is called ACTH, which is a long word. That ACTH is going to go to your adrenal glands, which are the ones on top of the kidneys. And they're going to tell the adrenal glands, hey, we need to release some cortisol. Along the way in this pathway, beta endorphins, which are those kind of like temporary opioids, internal opioids, are going to help create feelings of relief or pleasure. So over time, as this system is continually stimulated, because alcohol can trigger the hypothalamus to release that initial factor that releases B, then that releases C, and you kind of have the process keep kind of continuously revolving over and over. This is going to make it harder for the body to maintain balance, and it's going to disrupt the stress response system overall. And so emerging research is also pointing to similar patterns in compulsive sexual behavior, including problematic pornography use. And then you see this chronic dysregulation of the HPA axis, so what we just described, the hypothalamus, pituitary, and adrenals. It's been documented alongside alterations in thyroid, oxytocinergic system, so oxytocin, indicating a broader neuroendocrine shift in behavioral addiction. So, your body is one system. So if one system is being affected, HPA, it's likely affecting other areas as well. And so clinically, this is going to reinforce the value of stress physiology intervention. So sleep restoration. Most patients that I've seen or know with addiction have really poor sleep quality. So we're helping them support their sleep quality with functional medicine is a really good place to start. Trauma-informed therapy, recommending them seek certified or specialized trauma-informed therapists, mindfulness-based approaches, adaptogenic botanicals. I love, love, love the adaptogens to support adrenals, especially with addiction pictures. And they're generally really safe and well tolerated. So all of these things can support neuroendocrine regulation alongside, standard addiction care. Beyond just like alcohol or compulsive sexual behavior, stress is another major culprit. So like Dr. Tall mentioned, you think about these professions, medical professionals that have high stress loads, and any other profession that has stress, which I feel like is most professions, this can also kind of turn on the signal for that triggering of addictive behaviors, because like I mentioned in the beginning, we all have the same brain chemistry, we all have cortisol, we all have adrenal, so we all have the same pathways, which can be impacted through different stimuli. Let's take a look at another illustration from the journal Biomedicines, which is published in 2023. As we see at the top in the dark blue, healthy brain state, right? You have a little bit of adversity here, there, and then you kind of get into a chronic stress picture. When you have a chronic stress state, you see the reward center dopamine levels kind of start to reduce. You see your stress centers kind of peaking up, that corticotropin releasing factor, and then that all leads to this anti-reward brain state, right? So you have the addictions, you have anhedonia, which is like lack of interest in sex, I believe that's what that is, sleep disorders, depression, suicide, right? And so outside of that picture, like I said, all these anti-reward systems are kind of involving this corticotropin releasing factor, which we know comes from the hypothalamus, right? But beyond that, dynorphin also is something that steps into the picture. So like, what is dynorphin? Dynorphin is a potent, naturally occurring opioid peptide, it's protein, that binds to these receptors to produce effects like anxiety, dysphoria, and pain. It's also known as this endogenous punisher, right? Because dynorphin, it functions as a natural inhibitor for dangerous behaviors, right? So it's blocking our natural inhibition for dangerous behavior and dangerous activity. And this is going to play a role in stress, mood, addiction, where it can both maintain and potentially help treat addictive behavior. So, neurochemistry, neurotransmitters are a little more complex than just kind of, the oversimplification that I think sometimes we have for them. And I do think it takes a nuanced approach, especially with functional medicine, to really help your patients target and optimize their brain function and their neurotransmitters. So outside of that picture, all of these shifts are going to kind of help explain why people with addiction often describe the feeling anhedonia, loss of pleasure. It's why they escalate, or they're chasing a high, they're chasing more of a sensation, and why the cravings are triggered more and more by cues than real enjoyment. So I hope you got something out of those two images, but I would say overall takeaway would be, chronic stress, alcohol, chronic compulsive behavior, sexual behaviors, anything that kind of leads towards an addictive state can blunt our dopamine centers, can also upregulate our corticotropin releasing factor. The hypothalamus can throw off the HPA axis and lead to all of these kind of anti-reward brain states. So let's do a pop quiz. Which of the following contribute to HPA dysfunction? A, alcohol use disorder. B, chronic stress. C, compulsive sexual behavior. Or D, all of the above. Alrighty, so the correct answer is D, all of the above. And so if you're interested in learning more, right, about testing or functional approaches to support your patients with addiction, along with functional integrative ways to support their HPA dysfunction caused by addiction, again, logging into your advanced and clinical functional medicine platform, booking a call with us to review a case study and kind of help you offer functional medicine right away. This is a part of your program and it does not cost any extra. So we always encourage you to reach out if you're part of the program. So yeah, I mean, I would say, Dr. Tall, I think that some of the most interesting things I find with the whole addiction picture is just cortisol and the stress hormone cortisol, and how so many of us encounter cortisol dysfunction, and just people that I talk to in general who that do not have like addiction pictures will have extreme kind of cortisol imbalance picture. So like I said, our brain chemistry is all the same. So a lot of these principles can apply to other patients as well.
I'm so glad that you brought it up, because it's as we mentioned, it is a complex topic, obviously. Yeah. But as practitioners, understanding the HPA axis, understanding the differences between a dysfunction or dysregulation and or subclinical insufficiency, right, of the function of the HPA axis, those are two different things. But understanding how do we identify what the right lab testing, what is the specific protocol that we can use. And by the way, I'm so glad that you mentioned the testing of neurotransmitters. There's actually a test. There is a specific test that indirectly, obviously, measures the levels of the neurotransmitters. And we've ran those tests multiple times in practice, and especially in patients with, they're useful in patients with long-term mood disorders, depression, anxiety, really find out what's going on there. Patients with cognitive decline sometimes, and also patients with addiction. It's really helpful to really see what's going on there, because otherwise you're just, sometimes you're just guesstimating. I'll call it guesstimating, right?
Definitely.
And that's what a lot of psychiatry is. It's like trying to look at the symptoms and match, understand the imbalance, and then give a drug and then replace it if it doesn't work with another one, or stack drugs on top of each other. So we've seen patients that are on SSRIs, different medications. It was just not working well for them. They kept struggling. So this is where understand the HPA axis. We have a specific module on the HPA axis and evaluation and treatment protocols. And then same thing with neurotransmitters. We actually have in the advanced functional medicine program, we have a specified module just for neurotransmitters, and we go into like the different protocols. And also when you're in the program with us, book your coaching calls with your mentor, because we've actually seen a lot faster success, much better success, not just in terms of building a successful practice, but also applying everything to help your patients with our community members who have been scheduling the coaching calls. This is important. This is why we have coaching and mentorship to help you take everything you're learning and put it in practice, kind of like almost like a clinical rotation or hands-on approach for your patients. Really important. Dr. Esha, by the way, is one of our mentors. So we invite you to book with them. That's a part of it. That's included in your program.
Yes.
So beyond the factors that we just talked about, right? The stress, HPA axis, and also the neurotransmitters imbalance. We also wanted to mention nutritional deficiencies. So let's talk about this for a little bit. Nutritional deficiencies. We talked about nutritional deficiencies previously when we talked about metabolic conditions or other conditions. The thing with nutritional deficiency is there are multiple surveys that show that so many Americans are deficient in 1, 2, or more specific nutrients, even though calories-wise, we consume a lot of calories, right? So there's even that term, overfed, malnourished, right? So when we talk about nutritional deficiency, it's important to understand that nutrition plays a critical, often underestimated role in addiction vulnerability and also in recovery. And I'll give you an example. Chronic alcohol use impairs your absorption and utilization of vitamin B1, thiamine. And think about thiamine as the helper that helps our brain cells to make energy, more specifically our mitochondria. So when B1 is low, enzymes such as pyruvate dehydrogenase slow down. So our neurons make less ATP and acetyl-CoA. And so now we are in a state of energy shortfall. So the GABA glutamate balance could get out of balance. The acetylcholine drops. The oxidative stress rises, right? And the result is mood feels more flat. Irritability goes up, and self-control parts of our brain, circuits in our brain, struggle, right? So that's a perfect recipe. When you're not getting excited about anything anymore, right? You're more irritable, right? That's a really perfect recipe almost for being more engaged in addicting behavior, right? Especially you add some stress into that recipe. So this is where nutrients are really important, right? So B1 deficiency, for example, can throw neurotransmitters off balance and raise our vulnerability to addicting behavior. So, fixing the B vitamin, and there's a lot of other different examples we can talk about. Like magnesium is super important for our brain, yet a lot of patients are deficient in magnesium. So some things can be more easily fixed with a really good multivitamin, which we always recommend to supplement your nutrition. I can share that within a few years that we've tested intracellular nutrients levels. We found that even patients that have really, really, really good diet still had some nutrients deficiency. But there's two nutrients that I wanted to share with you more specifically, me and Dr. Esha. These are evidence-based. So one of them is N-acetylcysteine. So we'll put the name here, N-acetylcysteine or NAC. But there's a really interesting study published in the American Journal of Psychiatry in 2012, and showing that supplementation of NAC was associated with significant reduction in cannabis use among teenagers with cannabis use disorder. This is, of course, when combined with contingency management and brief counseling. But this was a randomized double-blind placebo-controlled trial. So there was a control group who received the NAC. This was 1,200 milligrams. If you want to know the dosage, it was 1,200 milligrams twice daily. So this was essentially 2.4 grams for 8 weeks. The other group received placebo, and NAC worked they found that ANC worked in part by modulating the glutamate transmission in the nucleus accumbens. This is essentially what they estimated to how it works. But that's the key brain region involved in craving and reward processing. And these findings suggest that NAC, as the authors concluded, may be useful as adjunct therapy for reducing addictive behavior, particularly in those with cannabis use disorder. Another interesting study published in the journal Clinical Psychopharmacology just recently, 2022, was using omega-3 fatty acids, so mostly EPA and DHA. And the supplementation, and we'll put here omega-3 fatty acids, EPA and DHA. Those are the two most important fatty acids that we want to that the study researchers used. And what they found is that this was, again, a double-blind, randomized, placebo-controlled trial. So again, we had a treatment group who received, each one of them received 3 grams a day of omega-3 fatty acids. The other group received placebo. This was for 3 months. And what they found is the treatment group had a lower relapse rates and improved clinical outcome compared to placebo, which means the authors essentially concluded that omega-3 fatty acids might support recovery and reduce addictive behavior by influencing neuroinflammation and neurotransmission. So this one was, we'll put on the publication for that. This is called Omega-3 for the Prevention of Alcohol Use Disorder Relapse, and it was published in the Journal of Clinical Psychopharmacology. And we wanted to bring to you a professional grade product for your consideration. We're not affiliated with any of those companies, but we do our own research. And this is Nordic Naturals Pro Omega 2000. It has higher levels of omega 3s, about 875 milligrams of DHA, and about over a gram of EPA in each dosage. So patients can just do 2 soft gels per day, and that's the daily dosage that was used in that specific clinical study to help and support them in their journey. Now, one thing that I will mention is that it's NAC and omega-3s could be a part of the consideration to help patients. Of course, make sure that they consume and absorb sufficient amount of nutrients, but we always have to look at the underlying causes. As we talked about, the HPA axis plays a role with it. We have to sometimes test for neurotransmitters. Is really, really beneficial. We had patients before that we tried all sorts of different things. They tried SSRIs, they tried all sorts of different therapies and medications for mood disorders and addiction behavior. And eventually, once we tested them and we saw exactly what's going on, that gives you a lot more data you can clinically use. And as Dr. Asha mentioned, neurotransmitters, it's really important for all of us to know the fundamentals of this so we can help our patients, right? So, Dr. Esha, this was really interesting. And of course, we invite all of our community members in the advanced and clinical functional medicine to jump on a call with Dr. Esha, jump on a call with one of our practitioners to help you apply everything into your practice, current practice, or if you're interested in growing, developing a private consultation practice, you can do that. So, Dr. Esha,
yes.
This
was excellent. I love that you recommended the omega-3, especially considering the brain is like mostly fat. Like I think that's just a genius recommendation, and it's like such a safe recommendation. So I love that you mentioned that one as like a good starting place.
Yes, absolutely, very important. And by the way, the strategies of digital detox, a few hours a week or even 1 day a week, and also applying. Have clear boundaries.
Yeah.
Reach out for support where needed. That's should apply for all of us, right?
Agreed.
That's something and help our brain. I mean, learning how to help, learning health and disease through functional medicine, I would say, is one of the things that helped me not just improve my patient's health, but also improve my own health, right? By
Mhm,
applying all
mhm.
these strategies to
I
be
tell you,
healthy.
every time we have do a podcast, I have another supplement I have to add to my list, my list of supplements. I love it. It's good.
Yes, absolutely. I know. That's why it's called supplements, right? It's to supplement, to provide something to our body that it might need extra of, or sometimes it's even providing our body something that um, we are using excessively,
Mhm,
right?
mhm.
Like one of my mentor always used to remind me, at a functional medicine mentor years ago, that used to remind me that every time we're stressed, you told me, Tal, every time we're stressed, our body, your adrenal glands overutilize vitamin C. And he's like,
Right.
guess what? We cannot make more vitamin C, right?
Yep.
So unless you are a goat, which goats are one of those animals that can produce, literally, goats can produce thousands of milligrams of vitamin C. Very interestingly.
I didn't know that. Oh,
Yeah,
to
yeah,
be a
yeah.
goat. Who knew?
Yeah, exactly. Goats can actually synthesize vitamin C when they are under stress. Humans cannot. So we just have to take it, right? We just have to supplement.
Good to
So
know. Never knew that.
yeah. So just a little interesting fun fact. So I want, obviously, to thank Dr. Esha for being here, sharing her years
Thank
of
you.
clinical experience. I wanted to thank our media team and Jacob for putting all of this together, allowing us to be here with you. And I want to thank each one of you for being there with your patient, being the guiding light. And as usual, we are here to support you. We have hundreds of community members, physicians, nurses, nurse practitioners, pharmacists, PAs, PTs. We got a variety of community members. If you're interested in learning more, join us. We'll help you grow your skills. And if you're interested, grow your own private practice. So thank you for watching, and take care for now.
Bye, everyone.